Hi, I'm Matt Ubel with Moreland Ear, Nose, and Throat. I wanted to talk to you in this video about hearing loss and what to do if you are having some hearing loss, kind of what to expect if you come see us, and maybe what treatments are available. So first of all, I wanted to answer when to come in about hearing loss. So kind of two categories. One is what we call acute hearing loss, what's happening like pretty suddenly. So definitely anytime you have sudden hearing loss, especially if it's only one ear, and you really are getting like no hearing out of that ear at all, that's a reason to come in kind of as soon as possible, because there are some things where if that's going on, one thing in particular where if that's going on, there are some treatments available, and the sooner you start the treatment, the better the likelihood that you get your hearing back. So again, sudden hearing loss, especially on one side where you like just can't hear anything on that side. So other reasons to come in kind of on like a short-term basis is, are you having pain with that also, or drainage coming out of your ear, or any vertigo, like this spinning sensation coming on at the same time as the hearing loss. Those would be reasons to come to your doctor or come see one of the doctors at Moreland Ear, Nose, and Throat. So the other reason, the second reason, is long-term hearing loss, right? The kind of the thing that we usually think of, especially as people are getting older, but even young people can sometimes have this, where they're just not hearing as well as they were before. So that's kind of the bottom line. Other things that might not be so obvious to people would be trouble hearing and noise. If you just can't hear as well, if there's a lot of background noise, or if there are a bunch of people talking and you're trying to listen to someone and you're not able to pick that up. A common one is when people say, yeah, they're turning the TV up way louder than they were before. Or, other people are complaining, they come in, they say, hey, why do you have the TV up so loud? That's definitely a common one that we get, where it's like they don't really realize it because they're just turning the TV up, and then someone else comes in and they realize, wow, you got the TV blasting here, so we should get your hearing checked. So those are all reasons long-term where you should probably come in to have us figure out what's going on and see what we can do to help you out. So next thing to talk about is what to expect. Say you come in to see us and it's about hearing loss, what are we going to do? So first thing we're going to do is talk to you, right? The best way to figure out what's going on is to talk to you and get some information about what's going on with you, and what are the symptoms that are associated with this, if anything, because that gives us a good idea of what's going on, what the next step is that we need to do. Because sometimes it is something where it's a sudden onset thing, and we need to really kind of jump into action right away. The next thing we'll do is take a look. So sometimes there's just no substitute for looking in your ears and seeing what's going on, because sometimes it's really simple. Like your ears are plugged with wax. I always love it. I always like do a little, yes, all right, because I can solve that problem quickly, right? We get that wax out of your ears and you hear better, and problem solved. I always love that when that's the case. Other things, like sometimes people have fluid in their ears, whether that's left over from an infection, or if their ears aren't popping properly, they're just, not able to equalize that pressure and it's building up some fluid there. There are definitely some things we can do to help out with those problems. And then a really common thing to do if you're complaining of hearing loss is get a hearing test. Sometimes that's really where the most information comes, because it helps us to differentiate what's the type of hearing loss. Is it a problem getting the sound from the outside to the inside, or is it a problem on the inside where you sense it? Helps us know how bad is it, what's one ear compared to the other ear. All those things give us clues to help us know what's going on and what's the best next step. So, and then as far as treatment options go, as I said, if it's something simple like earwax, we treat it right then, take care of the problem, get that wax out of there. If there's fluid that's built up, that's been there for a long time, sometimes we can just like put a little slit in the eardrum and suction that fluid out. It's really pretty simple. Or we need to put tubes in or something like that. Some conditions, there are surgeries that will fix the problem. There's a thing called otosclerosis, where the bones between the eardrum and the cochlea, where you sense the sound, they get kind of fixed in place, they can't move properly. And there's a surgery that frees that up and gets you hearing back to normal. So, surgery might be appropriate. I'd say most of the time it's not surgery that's the answer for this. And then if we figure out, look, it's none of those things, it's really on the inside where you sense the sound, depending on how bad that hearing is, we might say the best thing for you is actually using hearing aids. And again, can be young people, can be old, anywhere in between. So it really depends on what's going on. So if it is a situation where hearing aids are appropriate, we have you work with our hearing specialists. They're all audiologists. They've got doctoral degrees in audiology. So they know everything there is to know about hearing aids. They know about different types of hearing loss, and they know how to pair you up with the best hearing aid for your type of hearing loss and what's going on in your life, what you need in your life, so that we get you the help you need and, not have you paying for stuff that you don't need in your hearing aids. So that kind of runs the gamut. What, is it something simple like earwax? Is it something that's long-term and you need hearing aids for? So hopefully that answers your questions about hearing loss. The one thing I didn't mention, I forgot to mention this at the beginning about what might be the symptom that makes it come in, ringing in the ears. So a lot of people have ringing in the ears, and anyone who has that really should come in, get evaluated most of the time with a hearing test, because the number one cause of ringing in the ears is actually hearing loss. And you'd be amazed how many people, once we actually have them start using hearing aids and get that hearing information back to their brain, they actually stop having ringing in the ears. So we can talk all about that and whatever's going on if you need us. So if any of that's going on for you and you feel like you should get an evaluation by the ear, nose, and throat doctor or the audiologist to get a hearing test, then just give us a call. Our main number is at our Waukesha office, and we can make an appointment for any of our offices in the Waukesha area to help find what's going on with you. Okay, so hopefully that answers some questions and lets you know a little bit about what the process is like.